Hello, this is Carmel Angelo, Mendocino County Chief Executive Officer, and I wanted to take a couple minutes to talk about Mendocino County, what's happening now, but really to say I hope you are all doing okay during this very long, trying time. We here in administration wish you the very best through this period. We know it's difficult. We know it's difficult for you, difficult for your families, difficult for your coworkers, and certainly difficult for the clients that you serve and the 90,000 residents that we have here in Mendocino County. We appreciate you. We appreciate you working from home. We appreciate you coming into the office. We appreciate you continuing to serve the people that we serve. Thank you for that. What I'd like to do today is talk a little bit about the county, what we're experiencing, and then we have Dr. Andy Coren, our public health officer, with us today to give you a message. So with that, let me say that the pandemic has really taken its toll on you and on us and on Mendocino County as a whole. We keep track of the employees that are not able to come to work for various reasons that really is the impact of the pandemic. Some employees cannot come to work because they actually are COVID positive. Some employees cannot come to work because they have been exposed or a close contact of someone. And others can't come to work because of childcare issues that have all been caused by this pandemic. We keep track daily, and right now we're running a total of approximately 50 employees. While we have 1,200 employees, 50 employees may not seem like a lot, but if you look at those 50 employees on top of other employees who are not able to come to work for various reasons, it's a definite impact to the county family and to our county delivery system. So we want to say our number one concern is the health and safety of our employees and of the people that we serve. So if you have to stay home, this is not a message to say don't stay home. This is a message to let you know that we know that your departments, our county system is absolutely impacted by this pandemic, that we are monitoring it as closely as we can, and that we're doing what we can to assist you in continuing to serve the public, but yet take care of yourself and your families. With that, we would like to thank you also for the precautions that you are taking. We continue to mask, as you know. We continue to socially distance. Some departments have actually moved employees to other areas of the buildings, or employees are working from home. And we continue to limit our own gatherings. Certainly, it's critical that we continue with these safety measures because the pandemic is still with us. And we anticipate that the pandemic will continue with us certainly through this flu season and into the spring. So again, remember to mask, remember to socially distance, and certainly to limit travel and to limit your gatherings. Now, with that, we have our Department Operations Center that remains open through this pandemic. Our DOC is really run by Health and Human Services, and specifically the Public Health Department that does the tracing and the monitoring of our COVID positive residents in Mendocino County, and also those people that have been contacts. Our DOC is running into some problems in that we do need more assistance. So for those county employees that are listening, that have the bandwidth to assist, I would ask you to contact the Department Operations Center and let them know that you may have a few hours a week that you could help. Along with that, you will hear more from Dr. Coren today, but we know that the governor has enacted a new public health order, and that public health order is a limited temporary stay-at-home order. Dr. Coren will speak more to that, but that impacts us because it is essentially a curfew from 10 p.m. to 5 a.m. We will uphold that curfew. However, we do offer 24/7 services and emergency services. Those 24/7 services and emergency services will continue through this new public health order and this new temporary limited curfew that we're currently in. I would also like to say that the state does have a travel advisory. Again, Dr. Corin will speak more to the travel advisory, but I would ask our employees to limit your travel to only what is necessary. We know that this is difficult during the holidays. I personally will not be spending Thanksgiving with my family. I am going to uphold not only the travel advisory, but certainly the curfew that the governor has put in place. So we ask you to please stay safe, have your families stay safe, and if you can uphold the travel advisory, please do so. Again, as you know, the county offices have been closed for months now. Every month we evaluate whether we're going to open the offices this month or not. Our goal at this point is to keep the county offices closed until January 1st at the earliest. This was something anticipated that the state, the nation, globally, we would be in a surge during flu season, but now that it's upon us, it is somewhat shocking, and you will hear more about the numbers and the surge again from Dr. Corin here in just a few minutes. So we will not reopen county offices in December. They will remain closed. We know that many county departments are taking appointments from members of the public to come in by appointment only. That seems to be working. I think the public is extremely tolerant of the county's policy to keep the offices closed. Again, the offices are closed to protect you, to protect me, to protect the people that we serve. Limited gathering, social distancing, and masking. I did speak about that. I'm going to leave that one alone. I think at this point in time, after 11 months of doing this, we all know what that means. If you have a problem in your office with social distancing or masking, we want you to let us know. We have a Zoom meeting with the department heads every Wednesday, and so we are keeping track of what's happening in the departments. I'm very proud of the department heads. I think everyone, the elected officials and the department heads, have all pitched in to help and to provide additional staff to help with the pandemic response and to help in their own offices to keep their employees safe. So we hope you're experiencing the same thing. We continue to do testing and testing as much as possible. We continue to have OptumServe doing surveillance testing at the fairgrounds. We now are including a 7-day testing rather than just the Sunday through Thursday that we were doing. So we will have people at the fairgrounds doing OptumServe testing 7 days a week, and that will start on November 29th, I believe, the end of this month. So I go for a test once a week, and I do it because I think I should, and I want to remain safe and COVID-free, and I want to be certain that the people that are working around me are safe and COVID-free. So I would encourage you to have some type of routine within your departments or within your families for testing. I think it's really important that we know people can be asymptomatic and still be COVID positive. You can be asymptomatic and spread the COVID virus. So please consider testing. If you haven't been tested before, it's a very easy procedure. It's a Q-tip. It's just mid-nasal. And so I would encourage you, you could go on the lhi.care website and register, or you could walk into the fairgrounds. And if you walk in before noon, and there may be a slot for you to get tested. And finally, you'll hear more from Dr. Corin about vaccines. We know that this is all over the national news. We know that there are companies out there that are creating and in the final stages of getting an approval for a vaccine. The vaccine is not the issue, it's the vaccination, right? And we know that we need a vaccination plan. Our public health team is working hard putting together a mass vaccination plan. And so we expect that when the federal government has vaccines ready and those vaccines are shipped to California and California ships those vaccines out to the counties, that we will be prepared for vaccinations. We are all in this together. What else can we say except we are in this together? that the COVID virus is non-discriminatory. It could impact me, it could impact you, it could impact anyone. So it's really important that you take care of yourself, that you stay as safe as you can, which is why we in the county system have taken some very rigid precautions. Who ever thought that we would close the buildings? But we are doing this so that the buildings could open next year and that we have employees to serve the public. So with that, I have the pleasure of introducing Dr. Andy Coren, our public health officer, who will be updating you on our COVID status. Thank you.
Hello. Well, I will start with the data today. It's actually data as of yesterday. The total cases were 1,368 from our county. On November 19th alone, we found 30 new cases. We have 186 people in quarantine and isolated 106. We have 9 in the hospital. 5 are from Mendocino County. 2 are from out of Mendocino County. And I'll talk about that in a minute. In the ICU, we have no patients that I know of at the current time. We do have 3 of our citizens in rehab in Sonoma County, and the deaths from Mendocino County number 22 at this point. Our case rate over the last 2 weeks has increased 50%, and the numbers are actually varying pretty wildly because we do have a small county, but we are now in a purple tier. We're there with 41 other counties, up from 9 a week ago. The governor applied an emergency brake, as you may have heard on the news. Tiers have changed based on only a 4-day average and no waiting time to implement those changes. So just a brief review of the purple tier. It involves outdoor only for places of worship, restaurants, gyms, and personal care, though nails and hair can still be done indoors. Indoor retail is limited to 25% capacity. The schools that did open during the brief time that we were in red, and the ones that have been open, the K through 6 that were waived and childcare may stay open. The others continue distant learning. Small groups for children who need IEP, language assistance, IT assistance, that all continues in face-to-face. On November 19th, I'm sure you've heard, the Secretary of Health of California announced a new targeted response for purple tier counties called a limited temporary stay-at-home order from 10 p.m. to 5 a.m. At those times, only go out to get food or groceries or takeout. Medications are okay, getting gas and other essential services are allowed, or walking the dog. This will be implemented from November 21st to December 21st and then reevaluated. This is a little less than an all-out curfew, but more may be needed. We are in a surge now, possibly just beginning. It is time now to be vigilant. Nationally, the daily case rates are up 250% in the last 3 weeks. We have lost 22.5 times more Americans from COVID than all of the wars since World War II over the past 70 years. In California, we've generally done well compared to the rest of the nation, but we see now over 10,000 new cases per day. The case rates are accelerating 2.5 times faster than they rose in June and July during that surge. Los Angeles, which has had a case rate increase of 147% over 2 weeks, usually is what dominates the news. But in Madera County, a smaller rural county in the center of the state, they saw a 467% increase in cases over 2 weeks. The hospitalization rate statewide is up 63%, and ICU utilization is up 40.5% over the past 14 days. We now know we're seeing 12% of new cases wind up in the hospital 2 to 3 weeks later. At this rate, Mendocino County, we could run out of ICU beds in 2 weeks. We have already gotten some patients transferred up to our county from south of us who've run out of hospital beds and staffing. 48 Mendocino County employees have already been impacted by COVID. Why? We know cold, wet weather drives people indoors and makes it easier for the germs to jump around among us. This season, we've had holidays of Halloween and veterans and sporting events, but Thanksgiving and Christmas and New Year's are still upcoming. Heaven knows we need those breaks. People have working incredible hours under very difficult conditions and without being able to take breaks. But all these are opportunities for people to gather and for germs to spread. It's very dangerous. Outbreaks have not been responsible for the vast majority of cases. There's no specific industry. The majority continue to be community spread and close contacts. Many home clusters. Our data has shown that over the last 30 days, 50% of new cases are due to spread within the home. If you have been in contact with someone with COVID closer than 6 feet for more than 15 minutes cumulatively over 24 hours, or if you have any symptoms or you're coming down with a little something, don't go to OptumServe to be tested. That is only for screening. Call your clinic or provider who can order the different tests so you don't risk infecting the people at OptumServe. However, good news about OptumServe is the surveillance test will now be available 7 days a week, not now, but starting on November 29th. Remember the non-pharmacological interventions to protect yourself and your family. Mask up to protect now the wearer as well as those people around us. Wear one all the time except when eating. If alone outside, take a break. Mostly keep it on. Distance is very important for large droplets to fall, but there are still small aerosols lingering in the air, so ventilate all rooms as much as possible, opening windows, and don't forget the cars. Wash and sanitize your hands. New orders about gatherings are now on our website. I have recently reduced the maximum number of people to a gathering to 12 people. There is still a limit of 3 household units in a gathering, and I'll get to that in a minute. In Thanksgiving, the CDC guidelines for safe Thanksgiving is on our website. Here's a summary of my new advisory for holiday and travel. The CDC guidance that came out yesterday was clear in saying don't travel and don't have gatherings outside your household unit. Use a telephone or teleconferencing to Zoom your celebrations. If you're sick or you have been in contact with a COVID-19 patient in the last 14 days, if you're elderly or have chronic conditions, obesity, heart disease, lung disease, diabetes, cancer, or other illnesses or take any medicines that might affect your immunity, stay home. Most painful is this staying home and away from your families and friends during the holiday story. I can tell you that my mother-in-law just passed 91 years old, and her grandchildren have been asked to skip this year visiting. Other important advice is don't forget the flu vaccine. This Saturday from 8 to 12 will be a drive-through influenza vaccination clinic. If you do decide to gather, keep it to 1 household if possible, certainly no more than 3 and less than 12 people. These should be outside, especially if eating, and they last 2 hours or less. Keep a sign-in list to keep for 2 to 4 weeks for contact tracing if someone does become sick afterwards. Plan for gatherings and traveling during the week before by avoiding gatherings outside of your family unit, and consider getting tested. But remember, that doesn't assure that you'll be without the illness, and it could be asymptomatic. It just gives you a point in time information. Avoid physical contact with those outside your household. Wave instead of shaking hands, hugging, or kissing. If you'll be eating or drinking, remove your masks only at those times. Avoid shouting, singing loudly, chanting, playing instruments, especially wind instruments is what I mean. These increase the transmission and contagion. Avoid sharing phones, toys, utensils. Bring wipes to disinfect objects that were shared, and do this when you come home. Traveling, again, it's important to avoid all non-essential travel outside of the county, if you're traveling, the best practice is to quarantine for 14 days. Consult the California Department of Public Health website for high-risk areas inside the state and WHO for international travelers. Avoid Black Friday shopping. People will be clustering indoors and there'll be an increase of transmission. I know that all of us have already been through a lot and we've learned new habits. We've canceled or postponed seeing friends and loved ones. We've postponed milestone celebrations. Some have suffered closures, unemployment, bankruptcy, and loss of housing. We are tired. We're frustrated, annoyed, and angry at all the restrictions. But a better day is coming. Safe vaccines are on the way. We have to bear with this for now, for a while longer. Remember, we're doing this to protect ourselves, our families, and our friends. If you do need help from feeling depressed, remember we do have a warm line open Monday through Saturday, 7 to 6, and that is 472-2311. And I do wish you all a very happy holiday.
That was a lot of information from Dr. Corin. I think our numbers are staggering. It's shocking. Even though we knew at this point in the year we would be in a surge, that we would be in flu season along with a COVID surge, it's still shocking to hear these numbers. So I would encourage everyone to please stay home when you can, stay safe. Dr. Corin gave us a lot of information and a lot of educational information. It looks like today we are living by a new set of rules, and these are rules that must be in place to keep ourselves safe and healthy, our families, our friends, and the clients we serve. So again, thank you, Dr. Corin, for your message to us. I want to thank the county employees who tirelessly work to serve your clients and your customers, the 90,000 people that we collectively serve in this county. Thank you very much. This is public service. This is public service. So thank you, everyone. I hope you have a safe holiday season, and you will hear from us again.